It is always exciting to discover new research that reveals the healing properties of a supplement or a specific food. Today, we will be discussing a well-known supplement that recent studies have shown to reduce the risk of blindness and even help prevent it. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. So let's start our conversation about blindness and one of its main causes, macular degeneration. Macular degeneration, particularly age-related macular degeneration, otherwise is called AMD, is a leading cause of vision loss among older adults. This progressive eye disease affects the macula, that is the central part of the retina. It is responsible for sharp, detailed vision. Globally, 196 million people were estimated to have AMD in 2020, and this number is projected to grow to 288 million by 2040, largely due to increasing aging population. In the United States, AMD affects about 11 million people, and it's expected to double by 2050. So it is a real public health concern. AMD is the leading cause of vision loss in people over 50 in developed countries. There are two types of macular degeneration. The dry macular degeneration accounts for 85 to 90% of all AMD cases. This form progresses slowly and involves thinning of the macula as cells degenerate. Vision loss is gradual and can still significantly impact daily activities. The wet AMD is less common, occurring in 10 to 15% of cases. However, it is more severe and responsible for 90% of blindness related to AMD. The wet type involves the growth of abnormal blood vessels under the retina, which can leak fluid or blood, leading to rapid and severe vision loss. So let's go over the risk factors for AMD. So age is the biggest risk factor, and 1 in 8 people over the age of 60 are affected with AMD. Family history plays a significant role. The next factor is smoking. Smokers have 2 to 4 times higher risk of developing AMD than non-smokers. Gender. Women tend to develop AMD more frequently than men, possibly due to longer life expectancy. The next factor is race. Caucasians are more likely to develop AMD compared to African Americans or Asians. Then we have obesity, and research suggests that there is a link between obesity and progression of early and intermediate stages of AMD. How does AMD impact our vision? AMD primarily affects central vision, which is crucial for activities such as reading, driving, watching TV, recognizing faces, basically crucial for living a normal life. While AMD typically doesn't cause complete blindness, it significantly reduces quality of life. It makes everyday tasks challenging. So it's at least a partial blindness. So let's move to our article. So the researchers asked the question, does melatonin have any effect on AMD? They conducted a retrospective study using a medical database which contained 120,000 of medical records. That's in the United States. And those were from December of 2023 to March of 2024, focusing on patients who were 50 years or older. The study also had patients who had no history of AMD or who had a dry AMD. And the groups were divided by the factor whether they take melatonin or not. They used a special propensity score that reduces the bias by matching melatonin users with non-users based on similar characteristics. The researchers looked at two outcomes in the study: the risk of developing AMD or having it progress to the more severe form. This method ensured that factors like age and medical history were accounted for in both groups, making the results more reliable. So here are the key findings. The first finding was reduced risk of developing AMD. So among patients with no prior history of AMD, those who took melatonin were found to have 58% lower risk of developing any form of AMD compared to those who did not take melatonin. This suggests that melatonin may act as a protective factor for people who are at risk of developing it due to aging. The second finding was slower progression of AMD. For patients with dry form of AMD, melatonin use was linked to 56% lower risk of disease progressing to a more severe wet form, which can already lead to rapid and serious vision loss, as we discussed. This indicates that melatonin could play a role in slowing down the progression of this disease in those who are already affected. Why did melatonin have such beneficial effects? The study suggests that melatonin's protective effects against AMD may be due to its antioxidant and anti-inflammatory properties. Melatonin is known to fight oxidative stress, which can damage the cells in the retina and contribute to the development and progression of AMD. Additionally, melatonin may have anti-angiogenic properties, meaning that it could help prevent the formation of new blood vessels, and that's a key factor in progression of AMD to its more severe wet form. Melatonin is also thought to help preserve mitochondrial function, which is crucial for maintaining healthy cells in the retina. This combination of effects could explain why melatonin appears to be effective in reducing the risk of AMD and its progression. The researchers also showed consistency across age groups, meaning melatonin's benefits were observed in both younger and older patients in the study. The broad applicability suggests that melatonin could be useful as a preventive measure for a wide range of patients who are at the risk of AMD, especially older adults who are at higher risk, of course, due to aging. So what are the practical implications of this study? The study provides encouraging evidence that melatonin might be a simple, over-the-counter supplement that could help protect against one of the leading causes of vision loss in older adults. So it's extremely encouraging. By also potentially lowering the risk of developing AMD and slowing its progression, melatonin could be a valuable addition to preventative strategies for those who are at risk, which are a lot of us. However, remember that the study was a review and it was not a clinical trial. Appropriately so, the researchers conclude by recommending further clinical trials to explore melatonin's effectiveness in preventing AMD and slowing its progression. More research is needed to determine the optimal dose and treatment duration for achieving the best outcomes in people at risk for AMD. So in summary, melatonin supplementation was found to reduce the risk of developing AMD by 58%. and the risk of progression from dry to wet form by 56%. Thank you so much for watching. Until next time. Bye-bye.